Good morning.
Good morning, ma'am.
Good morning, ma'am.
Very good morning. How are you?
Fine, ma'am.
Okay. It will take so time to say. So now I think from 21st onwards, your offline classes will start now. Have you received your message?
Yes, ma'am.
So you are all coming.
Yes, ma'am.
Yes, ma'am.
All of you decided to come. Still some are in doubt. Yes? No answer. Okay. This is another one chapter, physiological effects of sex hormones. I have told you know that all of you what are the sex hormones in females. So I will tell some points. Already you know that, already I have told about estrogen, progesterone, these are hormone. Still I will highlight because in your competency this is also one topic is there. So that's why this time they have given, this is the first time I am taking. Previously this topic was not there. But nowadays they have included this topic also in your syllabus. So I will start with physiological effects of sex hormone. So types of female sex hormones. The two main female sex hormones are estrogen and progesterone. The two main female sex hormones are estrogen and progesterone. Although testosterone is considered a male hormone, testosterone is considered a male hormone. Females also produce and need a very small amount of this. Females also produce and need a small amount of this too. What about estrogen? Estrogen is the major female hormone. Estrogen is the major female hormone. The lines that the major shares comes from the ovaries. But small amounts are produced in the adrenal glands and fat cells. Small amounts are produced in the adrenal glands and fat cells. During pregnancy, the placenta also makes estrogen. During pregnancy, the placenta also makes estrogen. So, estrogen plays a big role in reproductive and sexual development, including estrogen plays a big role in reproductive and sexual development, including puberty, menstruation, pregnancy, menopause. Puberty, menstruation, pregnancy, and menopause. So this estrogen also affects the brain, Estrogen also affects the brain, cardiovascular system, hair, musculoskeletal system, skin, urinary tract. Estrogen levels can be determined by a blood test. So these levels can be determined by a blood test, while it can vary from person to person. It is vary from person to person. These are what considered the normal ranges in picograms per milliliter. So we'll see what is the normal range. First we will come to the adult female, that is a premenopausal. Adult female premenopausal, 15 to 350 picogram per milliliter. Adult female, that is a postmenopausal. Postmenopausal, it is a less than 10 picogram per milliliter. Adult male, it is 10 to 40 picogram per milliliter. Levels will vary greatly throughout the menstrual cycle. These levels will vary greatly throughout the menstrual cycle. About the progesterone. The ovaries produce the female sex hormone progesterone after ovulation. The ovaries produce the female sex hormone progesterone after ovulation. During pregnancy, the placenta also produces some. The role of progesterone is to prepare the lining of the uterus for fertilized egg. The role of progesterone is to prepare the lining of the uterus for a fertilized egg. And then support pregnancy. Suppress estrogen production after ovulation. Suppress estrogen production after ovulation. Progesterone levels can be determined by a blood test. The normal ranges are in nanograms, that is in picograms. This is in nanograms per milliliter. The ranges, the phase of ranges before puberty 0.1 to 0.3 nanogram milliliter. During first stage or follicular stage of menstrual cycle, it is 0.1 to 0.7. While ovulating or luteal stage of cycle, 2 to 25. First trimester of pregnancy, 10 to 44 nanogram per milliliter. Second trimester, 19.5 to 82.5. Third trimester, 65 to 290 nanogram per ml. Then we will come to the testosterone. Already I have told it is too small. So, the small amounts of testosterone come from the adrenal glands and ovaries. Small amounts of testosterone come from the adrenal glands and ovaries. This hormone plays a role in several body functions, including sexual desire, regulation of the menstrual cycle, bone and muscle strength. This hormone plays a role in several body functions, including sexual desire, regulation of the menstrual cycle, bone and muscle strength. A blood test can be determine your testosterone level. The normal range for females is 15 to 70 nanograms per deciliter. The roles your hormones play change over time. The roles your hormones play change over time. Hello. Class में देना. Sorry. The roles your hormones plays change over time. Female sex hormones are integral to many body functions. Female sex hormones are integral to many body functions. But your hormonal needs change a great deal as you leave childhood and enter puberty. But your hormonal needs change a great deal as you leave childhood and enter puberty. They also change dramatically if you become pregnant. They also change dramatically if the lady or anybody considered as a lady who will become pregnant, give birth or breastfeed. And they continue to change as near menopause. These changes are natural and expected. They also change dramatically if you become pregnant, give birth or breastfeed. And they continue to change as near menopause. These changes are natural and expected. In puberty, so each and individual person is different, but most females enter puberty between the, already I have told, ages of 8 and 13 years. And it all happens because of hormones. Because of hormones. The luteinizing hormone, that is the LH, and follicle stimulating hormone, FSH, are produced in the pituitary gland. The LH and FSH are produced in the pituitary gland. Production increases at puberty, which in turn stimulates the sex hormones, especially estrogen. So this increases in female sex hormones results in the development of breasts, the development of breasts, the growth of pubic and armpit hair, the growth of pubic and armpit hair, and overall growth spurt, and increase in body fat, especially in the hips and thighs, the maturation of the ovaries, uterus and vagina, then the start of the menstrual cycle. Sexual desire and contraception. Estrogen, progesterone and testosterone all play a role in female sexual desire, also called libido. Estrogen, progesterone and testosterone all play a role in female sexual desire, also called libido, and sexual functioning. Due to hormonal fluctuations, females are generally at the peak of sexual desire just before ovulation. Due to hormonal fluctuations, females are generally at the peak of sexual desire just before ovulation. There is generally less fluctuation in libido if you are using hormonal birth control methods. If you are using hormonal birth control methods which affect hormone level. So libido may also fluctuate less after menopause. Undergoing surgery to remove adrenal glands or ovaries cuts down on testosterone production, which can cause a drop in libido. Undergoing surgery to remove adrenal glands or ovaries cuts down on testosterone production, which can cause a drop in libido. Pregnancy. During the luteal phase of cycle, the rise in progesterone prepares uterus to receive a fertilized egg. During the luteal phase of cycle, the rise in progesterone prepares uterus to receive a fertilized egg. The uterine walls get thick and fill with nutrients and other fluids to sustain an embryo. The uterine walls get thick and fill with nutrients and other fluids to sustain an embryo. So this progesterone thickens the cervix to protect the uterus from bacteria and sperm. Progesterone thickens the cervix to protect the uterus from the bacteria and sperm. Estrogen levels are also higher. Estrogen levels are also higher, contributing to the thickening of the lining of the uterus. Contributing to the thickening of the lining of the uterus. Both hormones help milk ducts in the breasts to dilate. Both hormones help milk ducts in the breasts to dilate. As soon as conception takes place, start to produce HCG, that is a human chorionic gonadotropin hormone. This is the hormone that shows up in urine and is used to test for pregnancy. As soon as conception takes place, start to produce HCG. This is the hormone that shows up in urine and is used to test for pregnancy. It also boosts the production of estrogen and progesterone, preventing menstruation and helping to sustain the pregnancy. It also boosts the production of estrogen and progesterone, preventing menstruation and helping to sustain the pregnancy. Human placental lactogen. Human placental lactogen, HPL, is a hormone made by the placenta. I will talk placenta and all in further coming class. What are the hormones acting on placenta and what are the functions of placenta? What is placental unit? That all I will talk in coming class. In addition to providing nutrients for the baby, it helps stimulate milk glands from breastfeeding. In addition to providing nutrients for the baby, it helps stimulate milk glands for breastfeeding. Levels of another hormone called relaxin also rise during pregnancy. That's another hormone, relaxin, also rise during pregnancy. Relaxin aids in the implantation and growth of the placenta and helps stop contraction from happening too soon. Relaxin aids in the implantation and growth of the placenta and helps stop contraction from happening too soon. As labor begins, this hormone helps relax ligaments in the pelvis. As labor begins, this hormone helps relax ligaments in the pelvis. After childbirth and breastfeeding, once pregnancy ends, hormone levels start to fall immediately. Once pregnancy ends, hormone levels start to fall immediately. They eventually reach pre-pregnancy levels. A sudden significant drop in estrogen and progesterone may be contributing factor in the development of postpartum depression. A sudden significant drop in estrogen and progesterone may be contributing factor in the development of postpartum depression. Breastfeeding lowers estrogen levels and can prevent ovulation. This isn't always the case. However, still need birth control to prevent another pregnancy. Perimenopause and menopause. During perimenopause, the period leading up to menopause. The period leading up to menopause. Hormone production in ovaries slows down. Hormone production in ovaries slows down. Estrogen levels begin to fluctuate while progesterone levels start a steady decline. Estrogen levels begin to fluctuate while progesterone levels start a steady decline. As hormone level drops, vagina may become less lubricated. Some people experience a decrease in their libido and their menstrual cycle becomes irregular. Some people experience a decrease in their libido and their menstrual cycle becomes irregular. When you have gone 12 months without a period, so you have reached menopause. By this time, both estrogen and progesterone are holding steady at low levels. Estrogen and progesterone are holding steady at low levels. This typically happens around age of 50 years. But like other phases of life, there is great variation in this. Decreased hormones after menopause may increase risk of conditions such as thinning of bones, that is osteoporosis, and cardiovascular disease. Osteoporosis and cardiovascular disease. When hormones become unbalanced, hormones will naturally fluctuate throughout lifetime. This is usually due to expected changes such as puberty, pregnancy, breastfeeding, perimenopause, and menopause. Use of hormonal contraception or hormone therapy. But a hormonal imbalance can sometimes be a sign of something more serious, such as polycystic ovarian syndrome. Polycystic ovarian syndrome or PCOS. This is the most common endocrine disorder among young females. PCOS can cause irregular menstrual cycles and interfere with fertility. Next, androgen axis. This and overproduction of male hormones. Overproduction of male hormones. This can cause menstrual irregularities, infertility, acne, and male pattern baldness. Hirsutism. Hirsutism is an increase in hair growth on the face, chest, abdomen, and back. Hirsutism is an increase in hair growth on the face, chest, abdomen, and back. It is caused by excessive male hormones and can sometimes be a symptoms of PCOS. Other underlying conditions include hypogonadism, which is a shortage of female hormones, a miscarriage or abnormal pregnancy, multiple pregnancy, having twins, triplets or more, ovarian tumor. So when to see your doctor? You should always see your primary care doctor or gynecologist once a year for a routine wellness exam. Your doctor can discuss these changes and answer any other questions you may have. Don't wait until your annual exam if you are experiencing unusual symptoms. So, see your doctor as soon as you can if you are experiencing morning sickness or other signs of pregnancy, decreased sexual desire, vaginal dryness or pain during sex, skipped periods or increasingly irregular cycles, difficulty in conceiving, pelvic pain, hair loss or hair growth on your face or trunk, depression after giving birth, prolonged menopause symptoms that interfere with your life. So this is about your physiological effect of sex hormones. So in next class it is given a topic pregnancy and lactation or parturition and lactation. What is my topic? Okay, I think you are not seeing. I think it is a parturition and lactation. I may take parturition or before that I may take pregnancy and placenta. Either one of the class I will start. I require another three class, one class maybe when you will come after here. Offline class I may conduct. So till now, thank you very much. Thank you.
Thank you, ma'am.
Thank you, ma'am.
Thank you very much for listening so patiently.